All right, so we are officially starting at 1 o'clock. I want to thank everybody for coming. I did not make slides. What I'm hoping to do, and you know how proficient I am at this, is to bring up documents that will be available as well. As you know, we are combining these next 4 weeks into finishing up 142 and doing your 143. Our goal is to have everybody get their skill evaluations out of the way during these 4 weeks. And with these system that's been devised, I think it's a very doable situation. The first thing I want to do is, number one, welcome everybody. I'm so looking forward to having everybody back and for us to be on campus. Ms. McGraw is on campus right now doing a final walkthrough with the Office of Emergency Management, and so they're verifying everything and giving us their final blessing that we can go on. Everything's been measured from chair to chair, and with the chairs down in a supine position from headrest to headrest. So they really were being very good about trying to make sure that we were complying with what the OSHA and CDC standards were. So it's going to look, if they do everything they said they're going to do, very different for us in the clinic, because they will be putting, for example, they'll be putting don't stand here or stand here or don't stand here. We'll be having circles on the floor to make sure that we're maintaining space, as well as in the dental skills lab. There will be seating arrangements there as well to make sure that we aren't too crowded. But let's start out with looking at what the schedule is going to look like for you this next 4 weeks. On Monday, now it says 142, but it's 142/143. We're going to be working Monday, Wednesday, and Friday mornings for that. And we will be able to be on campus at 8:30, but the clinic is going to go from 8:30 to the clinic will be open from 8:30 to 2. You will be treating your patient, or you will be a patient, from 9 a.m. to 1:30 p.m. So at 1:30, it's going to be patient out of the chair, cleaning up, all that other stuff. So that gives you 4.5 hours of work time. So on you'll be working on partners. We're going to have 4 faculty, and you're evenly spaced apart on Monday, Wednesday, and Friday. And we'll be getting into that a little bit more. You are allowed on campus at 8:30. So yes, that's the time when you come in and you can start disinfecting your room and that type of thing, because at 9 o'clock, we need to be started, ready to go. We are working straight through. There's not going to be a lunch break. It's 9, 10, 11, 12, 1, 2. Okay, so if working until 2 will be 5 hours. And for most dental offices, you have, for example, an 8 to 1 and a 2 to 5 hours. So we are going to be working through. And we'll be getting into being able to take breaks and that type of stuff. Yes, Chris, do not skip breakfast. On Tuesdays and Thursdays, you'll have your 214 dental materials lab. There's going to be 2 groups, a Tuesday group and a Thursday group. I am not involved with that at all. And I know it was a mess with trying to register. So one student, I understand, was not assigned a group, but you will be on campus all day for that. On Tuesdays and Thursdays, there will be a lunch break. So from 12:30 to 1:30, I think.
Yeah, we start back at 1:30.
At 1:30. Okay, so I pulled up the wrong thing. At 1:30, because what's going to happen in between your lab times is a crew's going to come in and disinfect everything. So we're going to take care of our own disinfecting, but there is a crew that's going to come in, and I don't know if they're going to be using foggers or what, but they will be sanitizing everything, and then you'll be able to go back in. So you'll have Mrs. Mukhtar and Mrs. Martin on Tuesdays and Thursdays. Monday, Wednesday, Friday, there's going to be a mix of faculty, and you'll be rotating around, so everybody will hopefully be able to participate in a little bit of everything and not get stuck with like just me for the entire time. Are there any questions on the schedule? Okay, now, okay, what did I do? Ms. O'Brien's probably going to be laughing at me by the time I'm done with this. Screen share.
Did it. I'm not laughing.
Okay, all right. See, let's get this bigger. There we go. So this is the schedule. It's changed just a little bit from when I mailed it out, but the only people I mailed out the new one to were the ones that it was affected. So you have been assigned partners and dates as well as units, non-negotiable. Okay, again, this was all planned out to maintain our social distance. So on Mondays, which is this coming Monday, partner A will be the patient, and on Wednesdays, partner B will be the patient. You have the entire time to try and do a process of care from start to finish. And on Fridays, we are going to be able to have the wiggle room of catching up with some skilly vowels, which we'll be talking about in a couple of minutes, as well as trying to finish a process of care if you didn't get to that. So our goal for you is to complete treatment on one patient per week for the first 3 weeks. So we are hoping that you will complete 3 classmates. That means 1 appointment. On Monday, we're hoping you go from medical history to fluoride, okay? All the steps in between. Now, with that being said, we have made some concessions also with how we have to do things, because we're not going to be producing any aerosols. You'll be doing a lot of skill evaluations, that type of thing. But the good news is nobody's going to be a new patient. So everybody's going to have the medical history already in Dentrix, so we're going to be following up with that. Then the consent form, and we're going to be doing those type of things. And when we get into the specifics of, say, EOIO, skill eval and stuff, we'll get into that. Week 4. So you're going to be completing working on 3 different partners for the first 3 weeks, and that last week will be to finish up patients. If you still have a partner that you didn't finish, to complete skill evaluations. And if you happen to be all caught up, there's time as well then to practice radiographs in the radiology rooms with Dexter, because it's been a while since you've done that. So you're going to work with your partner for the week that's been assigned to you. And when you get together with your partner, you each need to really decide what type of skill evaluations are going to be good for each other. So if I'm the patient and I know I have certain conditions in my mouth, then I might not be a good one for something, I don't know, but work with each other. If you've got an aversion to something and you need to be the patient that you have a problem with a certain task being done on you, speak up, okay? This is going to be a cooperative effort. Amanda Savarance, let me see. Oh, there's not going to be a clinic assistant. Everybody's going to be working, okay? So this will be full-time for everybody. Will there be less stops in the process of care so we can move along faster? We're hoping your stops are going to be the same. Medical history, you need a check. EOIO, you need a check. Perio assessment, treatment plan, you need a check. But a lot of these things, you're also going to be having skill evaluations done. Now, again, there's only going to be maybe 3 of you instead of 5 of you that an instructor has to try and manage. So we're hoping it's going to be very doable. Does the 4th week have to involve one of our prior partners, or could it be someone more appropriate for that particular skill evaluation? Sarah, let's see what the 4th week shapes up like, because say if you have a partner that still needs to complete somebody else's process of care because of a previous week, then if you still have a skill evaluation that needs to be done, by all means, you can do it on another person. Yeah, because we are going to be making every effort and be as flexible as we can to still keep the learning there, but as well as making sure that you get these requirements done. Will we be working on mannequins for all the radiograph requirements? For 142 and 143. We do not have radiographic requirements for 142 and 143. Those have been removed. Those that have taken radiographs at the beginning of 142 that have already been graded, your grades are not going to be included in your 142 grade, but if you've passed an FMX or passed the bite wings or passed the PAN, that will go into your graduation pot. You're still getting credit for them. So no radiographs if our patient doesn't have them in the system, no radiographs. Okay, we don't have time for that. Your instructors will be charting the, well, Sarah, you're always going to do well with pianos, though. That's great. If you did pianos, that's good. That means you got it, girl. So anyway, if, I just lost my train of thought, so never mind.
Miss D, may I have a question? Is Gabriela.
No. Yeah, what's up?
If it's the same skill evaluation in 142, 143, do we do the skill evaluation twice, or one time it's enough?
I'm glad you asked that, because if I can do this. All right, now this is something I haven't emailed everybody yet, but this is your clinic requirements checklist. Can everybody see it? Do I need to make it larger?
Yes.
Good. Okay, so I've listed all the 142 skill evaluations and all the 143 skill evaluations. And what I need you to do is keep this handy, so when you've done something, now even if you've already done it in 142, say for EOIO, Explorers, Pro, that type of thing, put the date and your grade there, okay? It's just a check off so we know that you've done it, and anything blank will show us what you still have to do. So for 142, a number of you have already done. We've done instrument sharpening, ultrasonics, air powder polishing. It looks like a long list, but you've all done some of these, all right? The EOIO, most of you have done. Some of you have done Explorers. Some of you have done probing. So we were all kind of in a different place with these skill evaluations that we were able to do. So all of these need to be checked off, okay? Even if you've already done them in 142, it still counts in the spring. And then there's a line for others. So if you did your care of prosthesis or something else that's not listed, go ahead and list it there. You should have done a patient partner, okay, student partner. You should have done your self-evaluation for 142 and your entries, journal entries to date, okay? So we're stopping at that. So that is going to complete your 142 grade. And the percentages have been adjusted, so the quality points are not, quality points and radiographs aren't going to be incorporated in that. So that was for 142. At the same time, the 143 skill evaluation list is very short in comparison, but you will be doing some of the same things again. Calculus detection in 142, you needed to do 2 of them. You still need to do 2 of them in 143. So that means you have a total of 4 calculus detections to do. Well, gee, Ms. D, I'm only seeing 3 partners. Well, you can do more than 1 calculus detection on the same patient, just on a different quadrant. Does that make sense? Okay, so even if there's no calculus there, that is still, you're charting that there's no calculus there. So you need to do a total of 4 of those. Hard tissue charting is in 142. Perio assessment and treatment planning is, again, perio assessment and treatment planning in 143. The only difference is one's going to be at 75% competency and the other one's going to be at 80% competency. So, so that's that. You notice also that the OHE is broken up into visit 1 and visit 2. You get 1 grade for it, but by the way the system is in the computer, each visit will come up with a grade on its own, and then you'll get 1 final grade. So visit 1 is going to have a grade and visit 2 is going to have a grade. So that's why I split it up that way. You will have 2 self-evaluations that you need to do on 2 of your partners. Okay, you're going to be seeing 3. You need to do 2. Okay, and that will catch you up with your self-evaluations, and you will be starting to do clinic journals starting next week, whether you are a patient or an operator. Everybody does a clinic journal. Even as a patient, we are hoping that you are learning things and that your goal as a patient is to be more familiar with the process of care, learn the perio path on the computer better, you know, and that type of thing. Do we do probing on our partner or do we use the one in the system? You will be doing probing on your partner. So everything else is going to be new. Okay, so again, it would just be like starting a whole new recare except for the medical history. And that is, again, to get you familiar with what the process of care is and get you back into the computer and that type of thing. Now, having said that, if you are at the start of each new recare, what we want our students to do is to fill out a whole new form on everything, even though, say, for example, EOIO has already been done 12 times or 1,200 times. We like you to fill out a new form because you have fresh eyes instead of just copying and pasting it forward. We want you to be looking for what you need to be looking for. But that shouldn't take all that long. Okay, you've got 1 skill eval for EOIO to do if that hasn't been done yet. If you've already done it, even better. So I will be emailing that out to you. This is, if I can bring it up and make it big, this is what 143 is going to look like. Okay, it's going to be 50% of your grade. So lecture was 50%. Clinic is 50%. When you transition into DNH 244, excuse me, that percentages starts to then weigh heavier on clinic and less on lecture. So, so we're at 50-50. The skill evaluations are going to be 60% of your grade. Your 2 partners, you're going to be seeing 3 people, but you have 2 are going to be your test patients, and you might not want your first patient to be a test patient if you don't finish them. If you finish them, make them your test patient. Okay, 2 of them have to be test patients, which means you're filling out the self-evaluations on them. And the clinic journals for your 4 entries will be 10% of your grade. So radiographs are not involved in that, nor are quality points. Any questions on that? Okay, now I don't know where I put it. I had it here. I was so organized. I was so proud of myself too. Screen share. Okay, well, I had the question and answers that everybody sent on my desktop someplace.
Misty,
Yes.
I just had a couple of questions. As far as Clinic Mentor goes, are we keeping the ones that we had in 142 or are we assigned new ones?
You are assigned new ones.
Okay, and then if we had a test patient already completed before the quarantine, do they still count towards that 2 test patients, or are we still required to do 2 additional on our partners?
You are still required to do 2 additional because you have to do 10 to graduate.
Okay.
So this is to keep you all up and what am I trying to say? On schedule.
So we need 4 altogether?
At least, yes. How many were due for 142? 2. You had a total of 3, your patient partner, and then 2 other ones, but some people didn't even get to do any of them because they haven't finished any patients. So you need to do 2 test patients, and that'll get you up to 3. And
Had already completed one, then we just need to do 1 more to complete for that specific 142 requirement.
say that again.
So if I had already done my partner patient and I had completed a test patient before the quarantine, then do I just need the 1 more to complete the 3, or do I need 2 more to get 4?
You're going to do 2 more for 143.
Okay, so we need 4 in total.
Yeah.
Okay, gotcha. Thank you.
Betsy,
Yes.
I think it's actually 3 total. I'm looking at the
Okay.
amendment. There's an amendment for 142 as well, that I think the test patient was taken down to 1 test patient requirement and 1 self-evaluation for 142.
So you've done it.
So hopefully they've done it, yes. And then 2 more for 143.
Okay, so can you all see the questions? We good?
I can see them.
Okay, thank you. Ms. O'Brien kind of regrouped these a little bit to get them not so randomized. So we're going to go through these quickly. Will we be using and be provided N95 masks? All right, so the answer to that is yes. We're hoping for N95 or KN95. Things have arrived, but they're in pallets. We don't know what the school was able to purchase, but face shields are also in that kit. So the protocol is if you're wearing a face shield, a surgical mask, a level 3 mask is fine. If you're not wearing a face shield, then the N95 is more appropriate. So we will find out what we have available to us. We're hoping it's going to be an N95 as well as a face shield. And with that, then you'll be putting like a level 1, our little pink face mask over the N95, because that face mask will stay on the entire time that you're in clinic. If one of us gets in contact, what's going to be the protocol? Is everybody going to be quarantined? This would only be necessary if you weren't wearing proper PPE, okay? And we're going to be sticklers about that, because in order to be exposed, you have to be in close contact with somebody for at least 15 minutes with no PPE. That's what the science is saying right now. Even in a car with a loved one, if they're going out and about and work and they get in the car and you're driving with them for more than 15 minutes, that's an enclosed space. So you need to be in contact for extended period of times, 15 minutes or more. So you are going to be wearing PPE the entire time you're on campus. From the time you're out of your car, you're going to be in a face mask. You'll be in a face mask in the locker room. And when you come into the clinic, you will be then donning your other PPE and new face mask on for that. When you leave the clinic, you'll be taking your N95 off and you'll be putting on your level 1 again to go back into the locker room. So there won't be a time in clinic or on campus where you will not be wearing your face mask. Have there been upgrades to our clinic? Absolutely, yes. We had the Office of Emergency Management come in, and like I said, they measured everything, and luckily our units are 6 feet apart, and even in supine position, headrest to headrest, are 6 feet apart. Aerosol producing procedures have been eliminated for summer and possibly the fall. We have to see where we're going. So we are not going to be using any aerosol producing devices. That includes the air water syringe. Okay, we're not using it. We're not polishing. We're not using our prophy paste and polishing, and we're not using the ultrasonic scaler. Right, so we are limited with what we're doing, but this is for everybody's safety. And the good thing with that is it gets us to move along a little bit faster. What solutions have been discussed or proposed should students run into patient recruitment challenges? Now that is going to be in the fall, okay, and it'll be even after that. We're working with contingency plans even for the fall to minimize trying to bring patients in or the number of patients in. So students will be working in pairs in DNH 244. So that will require half as many patients. So there will be a pair of students assigned to one patient. We're also working on trying to get your littles from first year in, as well as family, friends, and the dental assisting students too. Might be a good pool to try and keep things in-house. So it's going to be a very different looking clinic than what we've ever had before.
Miss D?
Yes.
A quick question. For the dental material class, what kind of masks are we going to use? The same as the dental team?
Well, for dental materials, you only need probably a level 1, because you're not, unless you are doing, except for the time when you're doing impressions and stuff. Mrs. Martin's going to guide you through that with, because she's also making adaptations to how dental materials is going to be working.
I think we had to discuss it, and the idea was that you are going to explain
No,
us.
what is that she would present the background, the general. When you come, I will be sending out, specifics, and we'll be talking about it actually in lab.
Okay, Ms. Martin, thank you. Thank you, sure, thank you.
Yeah, no, we've, and we put our heads together and we discuss this as a group of faculty, because what one person thinks of, another one doesn't. So we've really tried to look at this in all ways to, again, to maximize your learning and minimize the exposure to anything. So we won't be asking you to do anything that's risky.
And also, what kind of gown, since we were talking about the PPE, do we use
disposable gowns have been ordered, hair bonnets and shoe covers. Now, the shoe covers and hair bonnets aren't really even, they're not mandated in any way. So some offices aren't wearing them. Shoe covers is a little over the top, but we will want you to be wearing a different pair of shoes to school and then changing them to go home in. Best practice is to change your clothes in the locker room, and don't wear what you're wearing in clinic home with you.
Before we get into the cleaning, I'm sorry, I'm asking for details. Is there a maximum amount of people allowed in the locker room or on the hallways, or we keep distance, or how do we get some info on that, or there is no requirement?
Well, the requirements are changing. We do have requirements for the dental skills lab. So you will be split up. There'll be a very limited time when the whole class will be together. Same thing with the locker room. If it looks like it's getting too full and you've got 3 people with 3 lockers right next to each other, that's not going to be good. Somebody should step out. So you will have to self-monitor. Does that make sense?
Yes.
Yeah,
I just wanted to know if there is something in place that we have to know, or is just our common sense that we need to apply for that.
Yes, common sense. Anyway, so again, if the locker room's full, just give it a couple minutes and let a couple people come out. So again, in the fall, we're working on trying to minimize the number of patients that you will need to bring in. Patients might be fearful and not wanting to come in, but we still have a lot of patients wanting to come in. So we're trying to maximize your learning again with and having you move forward as quickly as possible. So if we're close to forced to close campuses, what is the Dental Hygiene Administration plan for making up the clinic content? I've got my head in the sand. We're not going to do that. It's based on what the public health recommendations are. And right now I was watching an update, and Trump is saying, let's open all the schools as business as usual. And I'm going, ugh. Sarah Bruno. Oh, I have 11 patients who really want to come in. Oh, yeah, Mariah too. Are these the established recare patients? Yeah, some of both. Yeah, we've had Ms. O'Brien and myself and Stephanie have had contact with quite a few patients over the last number of months. Help, I'm overdue. When are you going to be starting up again? So it's important that you contact the recare people that you have been assigned to, at least introduce yourself, and you will get them in as quickly as possible. Let's see, what sort of clinical are we expected to participate in, and what are the facilities obligations to notify NOVA regarding COVID outbreaks within the facility? We have a very aggressive plan, and it's being adhered to. For example, Mrs. Heberly went to go pick up her keys. She was not on the approved list to go into campus, so they didn't let her go in. She wanted to pick up her laptop. Wasn't happening. So I'm very pleased with how Northern Virginia Community College is adhering to what the recommendations are, and they are being on the conservative side of things as well. For example, in the fall, if we don't need to be on campus, we will not be on campus. So your didactic courses will be on the computer. You're not going to be sitting in a classroom. The only time you'll be on campus is ideally for your clinics and your labs, local anesthesia lab, that type of thing, to again minimize people interaction. So they're being as conservative as they can. So for the summer session, we'll be working on classmates with no patients or community involved. You're going to be completing your 142 as well as your 143 requirements. There are not going to be any rotations outside the facilities at this time. So in the summer, there's usually no outside rotations, and 244 is when they start. And Ms. O'Brien is, again, being very cautious and conservative and going to minimize that for you, because we don't want to put anybody at risk, especially with the type of clientele that you might be coming into. And Ms. O'Brien, if anybody chime in, if you've got something to say, please. What sort of clinical are we expected to participate in, and what are the facility of, oh, I just did that one. What fever guidelines and temperatures? Okay, so we're following the recommendations. If your temperature is 100.3 or higher, you need to self-quarantine. We will be saying bye-bye. You need at least 3 days of normal temperature and no respiratory symptoms, and at least 10 days have needed to pass before the onset of symptoms or resolution of fevers. So anyway, the policy's been set. These are CDC guidelines, and we will follow them. We don't want you coming to campus if you're sick for whatever reason. We don't want you. We don't want you spreading your germs, even if it's just another kind of upper respiratory infection. Okay, so a lot of places are not taking temperatures routinely. Hopefully we will have a thermometer and we will be doing temperatures, because that is still best practice. If we should miss days or days for any reason, is there a grade deduction for the fall of 2020 with an incomplete? We will not have any incompletes moving into DNH 244. We've never allowed incompletes moving into DNH 244 as far as recently. And these 4 weeks, even though they've been condensed, so have the requirements. You will have 3 Friday sessions to work on skill evaluations, and then that final week is all catch-up time. So I think we've allowed enough wiggle room to be able to get everybody through this. That's the plan. Is the campus fully opening once we get into the next phase? Well, again, currently the fall, we will be distancing all the lectures and keeping the labs and clinics on campus only. They are not allowing any outside groups to come in as well. I'm the CE chair for Northern Virginia Dental Hygienists Association, and we have our meetings at the MEC. Well, guess what? Not this year. So they're minimizing outside traffic. They're also minimizing, we're not supposed to be bringing vendors in and having lunch and learns, which really bums me, because you know how much I like my lunch and learns and those type of things. So I'm working with Zachary and other companies to figure out how we can do things and still get the information to you, and hopefully a little bit of free food too. Are we allowed to use the locker rooms? Yes. Okay. But again, if it's crowded, stay out. The masks we've touched on a little bit. You're going to wear your mask after you get out of your car and coming into campus. Once you're in your clinical area, then you change your mask to a higher level, as well as your face shield, which I'm hoping we will have. And the same thing when you leave. You'll be wearing face masks leaving the clinical area and in the locker room, and wearing a face mask back to your car. So there will be no time when we will be without a face mask. Are our patients required to mask in the waiting room and the medical history and vitals? If so, are we providing them? I don't know if we are providing face masks, but the protocol is your patient will be required to wear a face mask at all times unless treatment prohibits it. So that's just safe practice. Just like us going to the grocery store or to get our hair cut or any place, we're putting on a face mask. So must they. They have to wear a face mask to come into clinic. So that is something that you'll be making them aware of at the time of their appointment. So if they refuse to wear a mask, they won't be permitted to come on campus, right? You have to have a face mask on. Now, this is in the fall, so it might change. We might go back to phase 2 or something by then, as they're talking about all the resurgence of things. Question, if we do a double up, setup in clinic in the fall, how will we get through our number of patients? That's been planned as well, and you don't need to worry about that at this point because it's all in the works. Ms. O'Brien has figured all that out for you. So it's all going to be good. Did you want to chime in on that, Ms. O'Brien?
Well, I would say you guys should certainly work off of your recare lists first. Not everybody on the recare list is going to want to come back. Obviously, some of you do have people that do want to come back, so prioritize them before like family or friends or or the first year students. I would say definitely get your recare list people scheduled. If there's a no-show or something like that, have a family member on call to be a backup. If you can, and remember you're going to be working with partners, so you'll have 2 sets of family and friends to to pull from, because we do have a lot of recare patients that want to come in and that are dedicated and show up, but a lot of patients, I've seen so many empty chairs in clinic for whatever reason. Patients don't, they say they want to come in and then they don't show up and things like that. So Mariah, I think that we will get through the patients that really want to come in. I don't think that's going to be a problem. I think the bigger thing is just making sure that you don't have an empty chair at any point, because, working in pairs, you're going to need that chair full like every clinic so you can get your requirements done.
And Ms. O'Brien's a numbers nerd, so she's figured it all out.
Yes, and Sarah followed up with a question. If there's 2 of us, who gets the point? So, this is still a work in progress, but what we're going to do, what we're predicting, is that like if you guys work on a 4-4 together, you will each do half the patient, half the mouth, half the probing, half the perio assessment. You guys will be working together, putting your heads together with the treatment plan and things like that. So, so you're going to be working, we're predicting that you're going to be working more quickly than you would on your own. So you'll be getting through more patients. And who gets the points? If you have a 4-4, you both get 4 points. You get credit for difficulty 4 and credit for perio 4, both of you. So yeah, so
unprecedented, yes, yeah. Woo-hoo is exactly right, Mariah.
So this is we're trying to make it fair to you guys, because none of this is your fault. We're working with very unprecedented terms for this clinic. So so we're hoping because you guys are I'm not trying to insult anybody, but you guys are more like novices than our usual upcoming 2nd year class, because you just haven't had the clinic time. So we're thinking this is going to be a good way for you to learn from each other, to learn from the instructors, and hopefully you guys will find it fair. I think it's very fair. So hopefully I'm
excited for this. I'm really thinking it's going to work out great.
Yeah, so I think it's going to be really a good experience to work with a partner. That way you guys can kind of bounce ideas off each other before the faculty gets involved. You can, if somebody does their scaling on their half of the mouth and the other person wants to take a look to see if they detect any calculus left, that's going to, so you guys are going to be working together on all these processes and learning from each other. And instead of us like giving you answers and giving you information, you'll kind of be figuring things out on your own, which is what you're going to have to do in private practice.
And you'll have an assistant.
Yeah, and you'll have an assistant. If we do go back to using aerosols, you'll have somebody that can do the high-speed suction at all times. You'll have somebody that can do the probing recordings at all times. So, so hopefully you guys will find it beneficial.
And I think we're going to find it works out so well that we're going to keep it like that, especially for 142 or something. I think it's a great idea.
Yeah, 245 we're planning to go back to regular, because at some point you have to launch on your own, but I think for 244 it's going to be a really advantageous model.
So question.
Yeah.
So one of my patients that I didn't get to finish is going to be coming in the fall, and he's my final test patient for 142. Now, when it comes to test patients during the fall when we're doubling up, would you recommend that both of the students make that same person their test patient or not?
Yeah, yes, they will. Usually what we do, Mariah, is the first patient that you finish in a category is your test patient. So your first, for instance, you need a difficulty 3 test patient for 244. So the first patient you finish for, that's a difficulty 3 for 244, will be your difficulty 3 test patient for both you and your partner.
Okay.
Yeah.
So yeah, that's all going to be hashed out. Trust the process, because part of that also is we have to keep checking with the CODA guidelines, our accrediting body, to make sure that we're still staying within the parameters of what we are mandated to have you graduate with, because we can't cut too many corners here. So some of the stuff that we do is because we have to do it. Now, to follow up on, I think Sarah had a question about the face mask with the patients. We can talk about that. I'm kind of thinking that it might be best, if the patient comes in with the face mask, how do they remove it? Who removes it? Where do they put it? Maybe have a baggie or a headrest cover available for them. They take it off themselves, they keep it in the baggie, and then they can take it out of the baggie and put it back on themselves when they need it. But if somebody else has a better, way to do it, let's talk about it. That's just what I was thinking. Okay, so that was the face mask. So our program in general, have there been any adjustments to our program requirements, such as the amount and types of patients and radiographs? Yes, we're really working on that. We have discussed, and it's an ongoing discussion on what we will be doing in order to comply with CODA standards, of course, as well as making sure that you can pass the boards. We have not been given any flexibility in reducing the requirements from our accrediting body yet. They still are saying we have to meet everything. Now, the class of 2020 had some concessions. They're saying the class of 2021 is not going to. They might change their mind. We don't know. So at this point, we have to keep with the idea that you need to keep the same amount of requirements. For the fall semester, Nova said schedules will be updated by July 6th. How will our schedules be structured so that we wouldn't have to stay in the parking garage and watch Zoom lectures before going into clinic? That is a very good question. We've rearranged the schedule, ladies, to accommodate that. So if you've got clinic, you've got a clinic day. And if you don't have clinic, you've got a lecture day, for example. So you 244 used to be on Monday morning while 141 was in lecture, and then they would have lecture and we would come in the afternoon. 141 now, first year clinic, is going to be all in the same day, all Monday. I have no idea how we're going to do that, but it's going to work. And so that will accommodate you to have all day Tuesday and all day Thursday for clinics, as well as Wednesday then to be your local anesthesia lab day.
Yeah,
So
can I just add to that, Betsy?
Absolutely.
So like Ms. D said, Tuesday and Thursday are going to be your clinic days. So we're extending the clinic by an hour for each clinic. So you guys are getting 4 additional clinic hours a week. And we're hoping these longer clinics will help you to finish the lower difficulty patients, like in one clinic instead of multiple clinics. So hopefully, but so anyway, your clinic hours would be from Tuesday from 8 a.m. to noon, and then 1 to 5. So Tuesday and Thursday, it'll be 8 a.m. to noon and 1 to 5. Yeah, Sarah, it's I'll just make sure that Miss McGraw we're allowed to do that. But yeah, I would say this is 99% sure that you guys are going to be in clinic all day Tuesday and all day Thursday. So if you need to start making childcare arrangements, those are the big days. Then Wednesday is going to be your local anesthesia day. So yeah, with Misty and myself. So the local anesthesia, there's 3 sections for the local anesthesia lab. They're each going to be 2 hours. So so the first one I think we said is 9 to 11, and then I think 11:30 to 1:30, and I'll send out an email with the exact hours. But they're
We
in
had to
2
marry
hours.
it up with radiology lab because
Yeah.
they have to come in and disinfect again in between.
Yeah, so the first lab is going to be 9 to 11. The last one I think is 3 to 5, and the middle one is somewhere in between there for 2 hours. So so just for childcare issues and things like that, and you're doing your schedule for the fall, Tuesday, Wednesday, Thursday are going to be the days on campus.
So the only thing we're really waiting on, we have given the administration our proposed schedule. We need to have the final blessing because they need to also see who else is going to be on campus when, because they are the ones figuring out how many people are on campus at one time. Now, Mrs. Brooks said in most offices make a point to let the patient know that whatever they bring in the office, it will need to stay on their lap. Nothing is placed on the counter and that type of thing. So, like purses, backpacks, drinks. So, and that makes sense because we don't want we don't want them carrying stuff in, and we don't want them carrying the aerosols landing on their stuff out. So this is really doing, again, best practice. Countertops should be clear of everything. I mean, even reception rooms don't have toys anymore. They don't have magazines anymore. Everything is taken off. So it's looking pretty barren.
Christy, I have a question. Are we moving into our operatories? Can we put our stuff in there or not?
No.
Okay.
No, you will for 244, only because this is just for 4 weeks. And when you come back in 244, the clinic is going to have a very different configuration. Ms. O'Brien's going to rearrange students and things. So it just, for 4 weeks, it's not worth it.
Okay. Are we allowed to hide a little snack somewhere for those long hours?
Well, we're going to get into that. Okay.
Thank you.
Okay, so once we hear from the administration that we've been given a blessing on and a go-ahead with the schedule, we will get it out for you. But for now, all of your lecture courses will be on Zoom on days that you're off campus. So there should be no day where you have to run from home to campus or from campus to home to do anything. Okay? So that's the good part. For the fall, will there be extra clinic sessions? Your clinics have been extended. Okay, your time has been extended, which has been great because as you found out, you're doing with a new patient, medical history, EOIO. It's time to dismiss the patient. Then they come back. Medical history, EOIO, radiographs. Then you have to bring them back. Medical history, EOIO, start probing. Then you have to bring them back. So the longer the clinic is, the more you can move forward. And hopefully this summer will kind of catch you up to speed with that. So your clinic will be longer to allow you to get more accomplished instead of having to stop and then start all over again on the next appointment. Are you going to be assigned unit, or can you store stuff? No. Alabama carts, they still have stuff in them. The students that graduated did come by on a Saturday and drop everything off, and the clinic is still a mess. Mariella was not happy with me when she came back to work on Monday because I quote unquote donate supplies if they didn't want to take them home. You know, here's some barrier tape, here are some patient napkins, here are some saliva ejectors, those type of things. And some of the things they left was just trash.
I'm scrubbing trays as we speak.
So yeah, and they left, yes, their impression trays, which are supposed to be bagged and sterilized, ready to go on your first day. They were not all bagged, and the ones that were bagged and sterilized had stone and alginate all in them. So, Mariah, some of my stuff is still in my unit, my drug cards, and it's probably still in your unit. Why did you have a unit? Oh, you're not talking about your Alabama cart, are you, Mariah? Okay. Well,
No, Jed and I shared the same operatory, and so he let me keep some of my stuff there, like my evals and a couple of my notebooks, my
Isn't he
OEG
so
book, and my
sweet?
drug
Oh.
cards, right?
Okay. Well, you know, the cabinets are going to, are good. Okay.
Okay.
So you're going to get new assignments in the fall. Is there any possibility of restructuring the current lab schedule for the summer? Absolutely not. Absolutely not. First year kits or second year kits, excuse me, are approximately $600. They have been ordered. I don't have the exact price yet. Jason from the bookstore is still working on that. Once we know, we will let you know. Okay, so they will be available for purchase, but you won't need them on the first day of class. Ms. O'Brien said, what is this, after Labor Day, the clinic session, the week of Labor Day is when
Yeah,
you'll
we
need them.
generally do it the Thursday afternoon after Labor Day. So I'm thinking that'll probably be the same day. So we'll need them before that.
Okay, so that gives you a couple of weeks then to get them. Regarding second year kits, can it be split up so that we are only required to buy the pieces we need right away? No, the kit is the kit is the kit. Unfortunately, I mean, you have to buy it as a unit. If we are practicing with Dexter for radiographs, will we be able to complete our skill evaluations on them too? At this point, for radiographs, no, but for your skill evaluations, it might be a combination of part of your partner and part of a mannequin. For example, polishing, your coronal polishing, you're not going to be polishing the mouth. You're not going to be running the handpiece in the mouth, but we need to see the handpiece and how you hold it and the fulcrum inside for all the different quadrants. And then on the mannequin, we need to see the speed and the pressure and that type of thing. So for that type of thing, there'll be a combination of both, but anything we can do inside the mouth that does not create aerosols, we will do inside the mouth. Are there changes to the clinical board for our year? There's a rumor that we will have mannequins. Is that correct? Right now, there is a mannequin-based exam that's available in addition to the live patient exam, but it's still in the works. One consideration is to make when selecting is that the states that are not recognized or accept mannequin-based exams for licensures need the live patient exam. So a live patient exam right now is better. We like the idea of no clinical exam at all, and that's what we're pushing for. But that's going to be under further discussion as you move along. So right now that is looking way ahead, but it'll be here before you know it. Also regarding clinical boards, is any part of it waived or altered? Does that mean that we could get a license in Virginia and not any other state, or would the waiver be valid nationally? So right now, the guideline is that it's not been fully laid out. The individual licensing boards decide what to accept and what not to accept. And that is, it's not the same throughout the nation. So a mannequin exam might be allowed in some states, but not allowed in other states. Wouldn't it be nice if we didn't have to worry about that at all?
And Misty, if I can add to that, we, most of our students that graduated are getting their licenses in Virginia, but a couple are doing it in Maryland, and Maryland didn't make any modifications to their licensing process. So those students will have to take a clinical board exam to get their licenses in Maryland. So it's very much state by state. Even in this metro tri-state area that we have here, you know, there's differences between Virginia and Maryland and DC. So you just have to kind of research, you know, what each one requires.
When I graduated, it was the Southern Regional and the Northeast Regional. I took 2 boards because Northeast was considered Maryland and DC, and Southern was Virginia, and there was no licensure by endorsement, that type of thing. So I didn't know where I was working. I took them both. Let me see. How will clinic time be divided among first-year, second-year students if we have to catch up? Okay, is the expectation that we will have hours forgiven, such as the class of 2020 did, or that we expect to graduate in the summer of 2021? So this was all that math stuff. We still have to maintain the CODA requirements. And CODA mandates a minimum of 624 clinic hours over 2 years, 624. So that's something that they're doing the math on, and it wasn't reduced for the class of 2020. They still met those 624 hours, but because, you know, they had summer hours and everything else, they had the clinic hours already. You don't, because of the amount of time we've been laid off. So right now, CODA isn't allowing any flexibility for the class of 2021, but the class of 20 was able to move to meet the requirement of 624 hours, as our program has a total of 725 clinic hours built in. So we've got more clinic hours built in. And even with that, and with losing the last 8 weeks of the last semester, we had that cushion. So we are in good places. Mrs. Martin, I think that's you.
What? I'm sorry.
Mute yourself, please. I'm blaming her. It might not have been. Patients who were previously working on, if they're willing to return, do we need to start all over again? As in pay again, completion of quads. Payment is not required unless you completed treatment. So if they're still in the middle of treatment, they do not have to pay again. Will we be awarded partial points for patients left unfinished? That is no. No partial points. Right now, it's been so long since you've seen the patient that you'll have to start all over again anyway. Parking codes for patient received in 2020, are they still valid? The parking codes expire each semester, but a new code can be issued. Parking again, parking is free for patients. They need to have that code. Parking implemented, let's see, in the spring, they'll need a new code. Patients will still have to have a parking pass for the fall of 2020. Or students will still have to have a parking pass for the fall of 2020. Now, this highlighted yellow one, nobody really knew the answer to. What documentation will be used in SIS for lab enrollment this summer for dental hygiene 142 and 143? Or what documentation will the college provide to students showing they have obligations in the clinic that can be used to verify reasons students can't work or assist in applying for types of financial aid and that type of thing? And I'm not quite sure what that was asking, because the tuition for financial aid, I believe, has already been used when you applied. Are there mandates for some financial aid that you have to work on certain things? I don't know. I'm not the proper person for that. We do have a financial aid office that can help you with that. So that's where I would direct that. Are we allowed to use the Cavitron in clinic? after this. Aerosol producing procedures are being eliminated or reduced as much as possible. So we need to look at things again at the end of summer to see where the CDC guidelines are. In private practice, everybody's all over the place. Some hygienists are not doing any polishing, they're not using any ultrasonics, some are just wandering around like nothing's happened. But the CDC right now is recommending eliminating aerosols as much as possible. So we will not be using the ultrasonic this summer. We will not be polishing this summer. Disposable lab jackets, I'm hoping, are going to be in the batch of stuff for the fall. If you have, we don't know what we're going to be doing about the disposable lab gowns. We have to see, number one, how many we got, first of all, and take it from there. But right now you have 2, which can last for the entire day. Some offices, as I say, it's not best practice. They're using their regular lab coats, their cotton lab coats, warm-up jackets, and wearing the same one all day, even though it's not recommended. Others are changing their gowns with every patient. Is it please possible to concentrate more on instrumentation skills other than taking vitals, medical history, perio assessments, etc.? My response was, we have developed a comprehensive plan to combine both process of care and specific instrumentation skills, right? So my answer is no. Okay, you still have to do it. Again, this is muscle memory. The more you do it, the faster it goes. Medical history, you're not going to have a new medical history that you have to do on anybody. They're all hopefully in the computer. So you're doing basically a medical history update. You're reviewing the medical history and that's it. You're not having to ask each and every question and fill it out and wait for signatures and that type of thing. So it should go faster for you. On the same train of thought, can we have some time with instructors in the clinic? Well, patients are not in the clinic, okay, to help with some of the administrative stuff. And we will be able to spend some time with you. I know Ms. O'Brien is going to be having a couple sessions with you as well on what clinical protocols are and that type of stuff. She does work with treatment planning and some helpful hints to transition the transition you into second-year students. Is there anything else you want to address with that, Ms. O'Brien, for the codes and that type of stuff?
Not too much. I mean, you guys could be working on it in the summer on your Fridays. That's kind of a free-for-all day. You can finish up treatment on a patient, or if you want to go over treatment planning with one of the instructors, I think that would be a good time to do that in preparation for the fall.
Okay, thank you. Would we be, please allow us to drink water and reduce the temperature in the clinic. Temperature, Ms. D gets very cranky, as I said, so I will be in charge of running to facilities and trying to keep us chilly. I like chilly. You can have covered water in the radiology rooms with the doors remaining closed, since the radiology rooms aren't going to be in use. Now with that, we want to minimize the donning and doffing of your face masks as much as possible. So we don't want them chairside. We don't want them in the cabinet where you can just kind of open up the cabinet, look both ways, nobody's here, take down your mask and take a swig and then pull the mask back up. That's considered a donning and doffing right there. And with even the N95s, there's a limit of 5 donning and doffings before you have to change your face mask. So we want to keep that as a minimum. So the radiology rooms aren't going to be used, and identify your bottle, know where it is, and you can run, even if you're the patient, you can run and get a drink of water and then come on back. That seems to be the best way we could come up with to maximize everybody's water capabilities as well as the aerosols. Are we going to be taking tests in the testing center? No. The open computer labs and the libraries are going to be open, but the testing centers are not. I don't know why, but that's that. When are we going to find out who our little sister or brother is? This is currently being worked on by the club. Okay, the Dental Hygiene Club is in charge of that. Are we going to celebrate for them as second year? Ugh, that's a hard question because we are not allowed to. What we can do is see if we can have the forum, for example, you know, that open area, and maybe have something to include social distancing there. But for now, they're saying on the campus, we're not supposed to have it. We're not going to have any food and that type of thing. So if we're going to have to brainstorm that, even if it's doing something Zoom, unfortunately. Are we required to update anything regarding drug tests and stuff like that last year for the Castle branch? That stuff is going to be sent out next week. Ms. McGraw's in charge of that. Are we going to have a tutor for the whole second year? He will not be available. Okay, now the second year students, you as second year can become a tutor for the first year, and Emily Miller is in charge of that. She's very difficult to keep to get in contact with, but she does get in contact with you. I would recommend, if you're interested, to send an email to her every week. I have talked with her saying, you know, we need to get you all vetted now so you are on board the first day of school, because you know what it was like the first day of school. You're panicked. And then if you have to start the process, it's going to be difficult. Let's see, if you're interested in being a tutor, it would be over Zoom, most likely, yes, because we're not going to be doing anything on campus unless it's an instrumentation, something on, say, a Friday, like second year came in and helped you with instrumentation. That will require some planning instead of just an impromptu thing, because we need to let the administration know and we need numbers and that type of thing. So, oh, Chris said, Emily said she would be in touch before Friday to those interested. So now's the time to reach out. And there can be more than one tutor. We've had more than one in the past. Are we allowed to use the library, hallways, and classrooms on campus to study? Not for the summer, okay? Not for the summer. The library will be open for the fall. Printers, I'm thinking you will be able to use printers. This will, again, depend on what protocols the facility has in place to disinfect after each use. So I'm not 100% sure on that, but I can't imagine printers being off limits. Are there any plans to open the clinic to outside patients before classes officially resume? No. Usually when students need to take a year off, they have to drop out and reapply the next year. Is there anything that will allow students to defer 1 year and rejoin the lower class without having to reapply? Unfortunately, it's not possible. That is not how the program's set up. And you lose too much that way. Are there any plans to bring the school kids in? Not at this time. We don't even know what the year is going to look like for the school kids. Parents have until what, the 15th or something to make up their minds?
Yeah, July 15th. Can I just go back to number 28? There was a second part of the question. How soon will they start seeing patients? We should start seeing patients the second day of the semester. So Tuesday is our clinic days. So that first Tuesday, you'll start seeing patients. We start right away in second year.
And before that, Ms. O'Brien is going to have students paired up, and you'll know who your partner is and that type of thing. So you can, the two of you can decide, you know, well, I don't have a patient. Well, I do. You know, it's that type of thing. So August 25th is the first day. It's a Monday.
Yeah, correct, Sarah. It would be that Tuesday. So
Or is it August 24th is a Monday?
I think the 24th is Monday, so the 25th would be the first clinic day, and we would see patients that day.
Yeah, August 25th. Okay. Are there any plans for volunteer events such as screenings? Not right now. Everything's been put on hold, ladies. Everything, which is really a shame because we had a lot of schools, a lot of facilities asking for us to participate in healthcare events, health fairs, and those type of things. And it's a lot of fun. So we will just need to see you when you graduate as registered dental hygienists and to work with us on the association level for these things and not as a school level. There's still going to be plenty of opportunity. If we had not been a clinic assistant yet, will we need to, no, there's not going to be any clinic assistants this summer. No clinic assistants. So
Probably
we're
not
not going to
in
be
the
taking
fall.
radiographs, so that's good.
Yeah, probably not in the fall either, since you guys are going to be working in pairs. You'll be just cleaning up after yourselves in the, you know, radiography area. So yeah, we probably won't have dental or clinic assistants because we want to maximize your treatment time.
There you go. Yeah. Should we all wear scrubs every day and bring our supplies just in case you need to switch to be a patient, because things do happen. To be safe, the best answer is yes. I didn't highlight this in purple, I apologize. So always verify with your partner. You know, just like you would with private practice or your regular patient, I'm gonna be your patient on Wednesday, right? Okay, you know, and then if something happens on Tuesday, you guys need to communicate with each other. So hopefully there's not going to be any surprises if you are doing good communication. Do you need parking passes for the summer? The answer for that is no. Will parking still be free for patients in the fall? We're assuming so, but if they were a spring patient, whatever coupons they had from the last time they saw you, or even from a second year student, they will need a new code. Who will be doing the lab disinfecting listed on the proposed clinic schedule? Is it our responsibility each day? If so, what does it entail? We are going to be keeping care of our units just as we always have. You're going to be spraying down all the housekeeping services, the you know, the cabinets and the counters and that type of thing. The college is going to be disinfecting everything when we leave. So you will be doing things just as you always have. And I'm going to remind you, don't forget to flush out your water lines. Even though we're not going to be using them, we still want the water lines flushed out. You need to be flushing the eye wash stations as well. That water's been sitting there since spring break, so we want to get that running through. Now, having said that about the air water syringe and everything, the system needs to be shocked 2 to 4 times. They need to chemically shock it because of all the standing water for the last several months. So the first shocking is going to be on Monday. No, I'm sorry, on Friday. So I do not want any water from the air water syringe being put in anybody's mouth. So don't even hook up your air water syringe. I mean, I want you to flush the system out if that's, unless we've been told not to, but no water, no water. How long do we get to eat lunch? Okay, yeah, there's not going to be any breaks, guys. We're going to be working straight through. It's a 4.5 hour morning to make the 5 hour to get us out on time. If you need to take a break, please do. You can keep things in the radiology room, a power bar, protein shake, something. Just make sure it's covered and labeled. but whether you're the patient or the operator, do what you need to do to stay healthy and keep your blood sugars up. We don't want anybody fainting. Is the dental clinic opened at the MEC? Right now, if you're referring to the restorative clinic, right now it is still closed. We don't know what the status is on the restorative clinic. So that went through, and I appreciate whoever organized this to put everything in writing. It just kind of helped to get the thoughts together first. What other questions are coming up? It's going to be mayhem, but it's going to be organized mayhem. We're going to be walking into clinic on Monday morning, and it's going to, we're just going to have to take a deep breath and work together. So, you know, I don't know if the Byrex bottles are going to be filled or if they're empty. We'll just have to see what the status is on that. But those of you that are operators, come in prepared to work the full morning. If you're the patient, come in and come in prepared to help as well, because it takes two minds figuring out the dentrix and that type of stuff. So we're there to help each other out. Will we be able to have our notebooks out? Yes, you can have your notebooks out, have them all in protective sleeves though. My dentist sister is rotating her N95 weekly, and they're reusing one mask 5 times that way. Do we have to reuse them? The best practice is not to reuse them. We are allowed to reuse them in times of shortages or during crises. We don't know what our supply is. Ms. McGraw put in a request to have 1 N95 per operator per day. So we're hoping not to have to reuse them. That is our hope. Nova policy, face shields. So do we go to our assigned unit and prep it, and then after that you'll contact us about the face shields? I'm hoping to know what's going on by Monday. All right, the supplies are in, they're in pallets, they need to be distributed to the different campuses, and then the campus has to divide them up. So we have, somebody said 10 different programs, so the different programs have to go and claim theirs. So I don't know what it's going to look like yet. But I'm hoping that face shields will be there. I heard they're the kind with the foam on the forehead. Nova policy that we have to sign before we return to clinic and lab. It's a sentence in the last paragraph. I understand that I have the option to postpone any clinical placement without academic policy. How are we going to complete the program if we don't sign it? That's a good question, because if you're not going to be able to complete the program. Now, I think that has to do more with, I'm not sure. Ms. O'Brien, help me out here. That's a good question.
Clinical placements more refer to the like physical therapy department, occupational therapy
nursing
department. They send them off campus to clinical placements. We're a little bit different in that everything we do is in-house. So I don't really think that applies to us like it does to other programs.
So there you go. Okay, what other questions? All right, well, you have finished the didactic portion of 143. I'll be doing the prep U and putting that up, and that should get you the your lecture grade. And for clinic, you will be starting Fridays will be the clinic journal dates. Everybody is going to be doing 4 clinic journals, whether you be the patient or the operator. You have new clinic mentors because we have different faculty working for these 4 weeks. Some of the faculty have changed. So we I've got that out. I thought I sent it to everybody. If not, I'm going to get it out. That's something that I'll be working on, I promise. Do we need to be fit tested for N95 masks? The answer to that is ideally yes. I understand the campus will have a couple of fit testers. Now, whether we will be able to get our hands on them or not is a different matter. So again, these are times of crises, so we can't follow best practice all the time. But if there's a fit tester, we will use it. And so I don't know the answer to that. So should we only enter the building on the first floor? And that's what Ms. McGraw is going to find out this afternoon. All right, she was meeting with the Office of Emergency Management for the final walkthrough. We can anticipate that all the doors will not be open because they need to track people. So it might be that everybody has to enter on the first floor through where the police station is. I don't know. I'm just assuming that. I know on Monday, Mariella went in expecting to be able to go in upstairs, and she couldn't, but the campus isn't open yet. So I don't have the answer to that, Joanna. Any other questions? So my faculty that are listening in, is there anything that you can think of to add? I know that Mrs. Brooks has been in the trenches. She's been into a number of different offices, so she was able to give us a lot of insight last night as far as what her offices are doing, and they're all over the place.
Yes, they are.
From best practice to no practice.
Well, they're practicing.
But, well, so anything that you think that we need to discuss? Sarah, what about FMX that we did but haven't been graded yet? I'd like the credit for mine, even if the grade won't count. You will get credit for it if you've passed it. That is something that if it hasn't been graded yet, Mrs. Heberly will grade it, and that will go into the bucket for your graduation requirements. Okay, as long as you've passed it, it will go into the bucket. So it's not like it's just there and you didn't take it for, and it's not going to count for anything.
Ms. D, I have a question regarding a discussion that we had before. If we are in a situation that, two scenarios, we cannot finish the clinic part, or our family interferes in our situation, we just, family problems in this pandemic are complicated. Our only option left is to apply again for the program. Are we allowed to apply one time or two times, or what are the rules for that?
You are allowed to reapply, and the only option right now that's set up, Gabriella, is to reapply. As long as you leave as a student in good standing, you will be looked at with the other applicants.
Okay.
Okay, so
Okay.
as long as you don't have a D in any class, if you have one D, you can reapply. If you have two Ds, you are not allowed to be, you're not allowed to reapply. And Sarah is saying it should be an automatic that we are readmitted for the pandemic. We don't have policy on that yet. It's not to say that there might not be policy, but at this point, the answer is no.
Okay, thank you.
Can we submit self-evaluation for my one patient I finished before quarantine? Sure. But you're still doing two. If you need to do one on your patient partner last semester and two this semester. So those are the minimum. You will be assigned self-evaluations as you go along in 244 and 245. So we will get you to the graduation requirements that you need without doing any extra ones. So, I mean, Cavneet, if you want to do one, you can. I would say no. If you don't have to do it, don't. That's my take on it.
Miss D, Shanita had a question that I think might have been passed by. It had to do with the clinics for materials. It seems everyone's been registered possibly for Tuesday per SIS. And I think there's still some, I think people are unclear on what day they've been officially put into.
Oh, that was a big mess, as was 143 because my site disappeared.
I'm unmuted now. Can I see
Oh,
that?
hey, oh, Mrs. Martin's still here. Yes.
I was
You're breaking up, Mrs. Martin.
just sent her.
I can't hear her.
Mrs. Martin, we can't hear you.
And I don't know, like I said, the part that
If you, yeah, you might have to go into a hallway or something. We still can't hear you. Well, while we're figuring out what Mrs. Martin is going to talk on, because she is your 214 instructor, Brooke said, since we won't have our own unit set up yet, which you won't, should we bring our supplies in each day? Is it a good idea to still roll our carts into the unit and take them home each day like you were doing? I would say yes. And once that cart is open and everything, I don't know if we can put it in the unit that's not being used just to get it out of the way and out of the line of fire, just in case there are aerosols. So yeah, you'll have to schlep it all back and forth. So Mrs. Martin, are you back on? Oh, or Sarah said, or can we leave them in the clinic overnight if we prefer? The problem with that, Sarah, is it's unprotected. I wouldn't trust anything overnight. Nothing, it's not a high stealing place, but we can't guarantee that things are going to be safe and still there when you arrive. That's the problem. So I don't think Mrs. Martin's going to be able to figure out what to do. It's very hard using a cell phone in the clinical area, especially when you're in the sterilization area, because everything's so heavy.
Oh, sorry.
Is that you, Mrs. Martin?
Yeah, I'm back. I was in an elevator. I'm sorry. Miss Corb, Stephanie, I guess didn't notify them. I asked her, and I'm going to send out a list tonight of the assignments.
Okay.
Are you off now? Did you end the meeting?
No, no, everybody's still on, but we were just kind of waiting for you.
Oh, sorry. I was in an elevator. I didn't know because I never have my phone. And here I am back at the condo and I've never have my phone out. And so.
Oh my, you're home. Okay.
Yeah. So anyway, yeah, I can only scrub for a couple of hours.
So Mrs. Martin will get your assignment out to you.
Yeah, it's coming out. I'll send out a list tonight or tomorrow morning. Yeah. Okay. Sorry. Yeah, I just found that out myself. So right before I left.
So everybody's starting from scratch with their Tuesday, Thursday?
I'm sorry, starting from scratch.
I mean, like they don't know if they're a Tuesday or Thursday yet.
I guess they don't. I don't know. I had nothing to do with the process, as I keep telling them and everything. And I just got the list before I was walking out the door from Miss Steph, and they've been assigned, half and half. And I don't know who got what, how their requests were, but they got divided up. And I have the list. I have to type it up though. It's an Excel spreadsheet. I'm gonna have to type it up and I just send it out. And the one student that I sent an email to was not on the list, so had to be put on Thursday because there was no other openings anyway. And so
but I had nothing to do with the process, and it just has to be, and it doesn't show in my SIS, it didn't for me. Anyway, so they're only listed just the whole class, yeah, but she broke it up into 2 groups, so I have the 2 groups.
Okay, because Chris said, someone said they are on Thursday. Gabriella's on Thursday too, so some of them know.
Yeah. Well, I don't know. Yeah, well then that's fine. Yeah, those are I know that Gabrielle is one name I just happened to remember, and she was on Thursday, so I'll be sending that out.
Okay.
Yeah.
Kavneet asked about showering in the locker room. The shower is functional, and that's all I'm going to say.
I don't know if that's included in the disinfection.
Okay, so are there
Way to be vague.
Well, it's functional. I mean, I don't know when the last time it was used or anything.
Yeah, and like I say, I wonder if it's on the disinfection list.
Ugh. Anyway, so any other questions, ladies?
One last question, Misty. Can we use our own lab coat or face shield and stuff just in case if the one that you guys provide is hot, or we just, you know?
You mean your disposable lab coat?
Yes.
For the summer, I would say yes.
Mm-hmm.
I don't care.
Okay, cool. Thank you.
Yeah, I know you. Oh, you were doing. What face shield did you end up buying, Adriana?
There is 2 actually. They're kind of pricey. One of them is like 40 something. The other one is $50. One of them moves up so you can have the loops and at the same time not take it off, and comes with 2 extra plastic shields with it. And it's pretty nice and it's very light. And I know the foam ones that you were talking about is what I use at work, but I couldn't use my loops with those. So that's why I ordered my own.
Yeah, and we had no control over that. Now with the first year kit, I have included face shields for them, and we're hopefully they will have them, the OptiOp 2s, which are supposed to accommodate all loops.
So I've gone through several shields. I've had those regular foam ones you can wear with your loops, but you just have to take your light off. So that could be an option if you don't have anything else. And then
But I like my light better than the magnification.
well, until we can maybe get the ones that you were talking about.
Yeah.
Yeah, I can send the links to you, Misty, and if people want to order them.
Oh, absolutely. We'd love to take a look at them. I predict, ladies, that all of you will want to order your own face shields. You're just going to want to. It's going to be standard operating procedure when you're using ultrasonics and those type of things. It will be the new normal.
Misty, I ordered something a while ago, and the shipping time, it's 4 weeks. I think I got mine in 2.5, 3 weeks. And also I have seen the hygienist that I go to attaching a light on the top of the shield. She said if she wears it under the shield, it has a glare. So that's why she attached it on the top of the shield. It's the shield that you can take it up and down, move it up and down.
Cool. Well, I can't wait to see what people are getting and wearing. I've ordered some from Designs for Vision, and I don't like them. And I ordered OptiOps, but I don't know when I'm going to get that. I like the kind that flips up. I just like the idea of it flipping up. But Mrs. Brooks had one that said the plastic was very flimsy.
I just
The
said
it's flimsy, yeah.
So I want to see what everybody gets, and then hopefully we can take a deep breath and find out what the really good ones are.
Yeah, I just sent them to you from the Ultra Optics. That's the
Adriana, you were fading in and out.
I was just saying that I just sent it to you. I texted it to you.
Oh, okay. Thank you.
You're welcome.
All right, ladies, I want to thank you for your time. It's been an hour and a half, so it's time. Thank you for your patience. I promise, we will all get through this. We just have to just keep taking a deep breath and working together as a team, and we'll get there.
We will.
We will, yeah. Contact us with emails. I'll get the mentor list and everything out to you. I thought I had sent that out already, but maybe I just gave it to the faculty. I'll get my act together. If we don't have loops, do we still wear safety glasses under the shield? You're not supposed to have to, but I would, just it gives you that one extra layer of protection.
Yep.
So we'll figure it all out. Okay, ladies, thank you. That if there's no other questions, we'll see ya.
Thank you, Misty.
Bye, Misty.
Bye.
Bye.